Hello, Professor. I am Feba Anish. I am studying Nursing Leadership and Management course from Seneca College. As part of my curriculum in Nursing Informatics, I am going to reflect on my weekly learning. In week 2, I have learned about the importance of electronic health records and the nursing informatics. Nursing informatics is within the nursing profession, which combines nursing science, computer science, and information science for handling and communicating the patient data for the patient safety. Whereas the health informatics is a broader term which integrate computer science, information science, health science, and the cognitive science for handling effectively the patient data. Every nurse should have nursing informatics as a foundational skills which helps the nurses to use the electronic health records effectively. It is really essential to maintain the patient data for proper clinical judgment and decision making. For example, if a patient have any emergency situation, all the health professionals need to be accurately analyze the patient data. If it is maintained electronically, it is easy for the healthcare professional to access that. Not only that, if a patient need to be transferred from one healthcare setting to the another healthcare setting, these records can be transferred easily compared to the paper-based records. The second thing that is, it can maintain the privacy and confidentiality in records. In that case, only the authorized person can see that patient records. These things cannot be possible in paper-based records. So, the safety of the patient and the privacy of the records is an advantages in this healthcare record, electronic health records. Then there are various nursing informatics roles in Canada, such as nurse analyst, nurse informatist, nurse specialist, and chief nursing informatics officer, nurse educator, director, and so on. So every nurses should have follow some guidelines for this. CNA nursing informatics guidelines are that every nurses should know about the importance of nursing informatics, and they have to use the electronic health records effectively for the proper decision making in direct and indirect nursing roles. The appropriate use of informatics aligns with the primary healthcare settings also to prevent the disease and give the high quality care to the patient. Then not only the CNA, the CASNS nursing informatics also have three major guidelines, which firstly to improve the communication, which means all the nurses like novice, experienced, and student nurses, everyone has to promote the communication to integrate the nursing informatics as to the entry to the practice level. And secondly, second guideline is that the nurses increase the capacity of the professionals to teach the nursing informatics to their students. And thirdly, they have some stakeholders to analyze the materials for the nurses to study and what and all curriculum they have to add on their subject to teach the nursing informatics to the students. In week 4, I have learned about the hardware components of the computer, input, output, and storage devices. Hardware components are classified into two, such as internal components and external components. Internal components are located inside the computer, such as motherboard, read-only memory, random access memory, graphic card, etc. Whereas the external components we can see by ourselves, that is located outside the computer, such as monitor, keyboard, and mouse. CPU is considered as the brain of the computer, which perform commands and processing information and control operations. CPU can be visible in many devices such as laptops, desktop computer, tablets, smartphones and smart televisions. Data processing is also known as input. The parts which is responsible for that is processor, read-only memory and motherboard. For output to the end user, the part is responsible for that is printers, monitors and speakers. Whereas to store and retrieve data, we are using the random access memory and hard drives. Nurses in the informatics role should have the adequate knowledge about these hardware components because they have to store, retrieve and collect the patient information. As a future nurse leader, it is really essential to know about the electronic health records, which helps the nurses to feed the patient information accurately to that. So, one can easily access these data in one touch. For example, if we can see the patient family history, patient medical history, allergy history, vital signs and prescriptions, medication list, consultations, everything in one touch. So, it not only saves the time but also it provides quick decision making, clinical judgment and to provide high quality nursing care. So, not only that, we can avoid the repeating many laboratory tests due to these electronic health records. For example, if a patient is transferred from one healthcare setting to the another healthcare settings, the repetition of the laboratory test can be avoided due to these electronic health records. So, I can say that overall it is an inevitable role for the nurses to gain an adequate knowledge about the electronic health records and the importance of nursing informatics in these roles. Thank you.